Okay, picture this. You're walking into this, like, bustling hospital, right? And you're tasked with implementing a brand new electronic health record system.
Oh, yeah.
Or, maybe streamlining those existing workflows that are already there.
Mm-hmm.
And either way, the pressure is on.
Oh, yeah.
Patient care, clinician satisfaction, even like regulatory compliance.
Right. Yeah.
All of it hinges on getting it right.
Right.
But how do we even know what the right requirements are
Yeah.
to focus on?
I mean, that's the million-dollar question, isn't it? That's what everyone wants to know. What are the right requirements? And that's what we're diving into today.
Absolutely. So we're going deep on an article called Healthcare Requirements, Gathering and Prioritization Strategies.
Okay.
Think of this deep dive like your master class on how to handle all the stuff that goes into healthcare IT implementations and system integrations.
Yeah, for sure. And specifically, we're giving you 3 strategies that healthcare business analysts use to gather and prioritize requirements.
Awesome. So before we jump into the strategies, let's acknowledge the elephant in the room.
Okay.
Healthcare, it's a complex beast.
It is, yeah.
You're juggling clinical needs, administrative processes, the technical side of things,
Right.
trying to harmonize all of these. When you introduce new technology, it's a challenge, to say the least.
It is. And, a lot of times what I see happen is, a healthcare organization will get really excited about a new system. And in theory, it looks great. They've seen the demos and everything. But then when they actually go to implement it, it falls flat because it doesn't fit into the clinical workflows or how the, clinicians are interacting with patients or the culture even.
Okay, so how do we avoid falling into that trap?
Right.
Well, our article highlights a strategy called contextual inquiry and job shadowing.
Yeah.
Can you tell us more about that?
Sure. So think of this as really getting into the clinical environment. So
Right.
going beyond, those formal meetings and actually stepping into the space. And the idea is to observe clinicians and staff in their natural habitat.
Oh, I like that, their natural habitat.
Yeah, just seeing how they use the current systems and paying attention to what goes unsaid. Because sometimes people are so used to workarounds or they've been dealing with the frustration for so long they won't even mention it.
Interesting.
But when you observe them in action, you can discover those pain points.
So it's not just about asking, what do you need from a new system?
Right, exactly.
It's about observing their behavior, their actual workflow.
Yeah, let me give you an example.
Okay.
Let's say you're observing a nurse during medication administration.
Mm-hmm.
Everything seems to be going smoothly, but you notice a slight hesitation when they scan a medication barcode.
Okay.
They have to adjust the angle several times for it to register. That might never come up in a meeting.
Right.
But because you're there watching them, you realize there's an issue with the scanner sensitivity.
Interesting.
And that's something you can address in the requirements for the new system.
That's a great point. Sometimes those little things, if you're not actually there watching, you just don't realize.
Right, you miss it.
Yeah, those real-world observations can be so valuable. But let's face it, sometimes observations aren't enough.
Yeah, that's true.
You need data, you need a way to prioritize.
Then you organize everything, yeah.
And for that, our article brings up stakeholder interviews and surveys.
Mm-hmm.
And it looks like they specifically mention using a weighted scoring system for the prioritization.
Yeah, it's a great way to bring structure to the whole process.
If this sounds interesting to you, find additional information pinned in the comments and description sections. So what makes this approach so effective?
Well, like I said, it brings structure and objectivity to the process. And I think that's really important because you're going to be dealing with so many voices and perspectives.
Yeah.
You're going to be talking to physicians, nurses, billing specialists, IT security.
You got to get everybody involved.
Yeah, so you start with structured interviews with, those key stakeholders across all the relevant departments.
It's like getting a 360-degree view of everyone's needs and the pain points that they're experiencing.
Yeah.
So how do you go about gathering this information during those interviews? What are you asking?
So you're not just asking open-ended questions.
Right.
You're really trying to dig into specifics. What are your biggest challenges with the current system?
Mm-hmm.
What features are absolutely essential in a new one?
Okay.
How would you define success? What are your criteria?
Yeah.
And you can even use surveys to gather more data, especially if you have a huge group of stakeholders.
Right. Makes sense. Okay, so now we've gathered all this input. We've talked to all these people.
Right. A mountain of data.
How does that weighted scoring matrix come into play? How do we use that to sift through all of this?
Okay, so this is where it gets really exciting.
Okay.
You take all those requirements that you've gathered and you evaluate them against a set of criteria, and each one has a weight that reflects how important it is to the project.
Okay, so what are some of the typical criteria that you'd be looking at?
So some common ones are clinical impact, regulatory compliance, operational efficiency, and technical feasibility.
Okay, so it's not just about what's nice to have, it's about what's truly like mission critical.
Right, exactly. So for each requirement, you ask yourself, okay, how much will this impact patient care? Does it address any regulatory mandates?
Hmm.
Will it streamline workflows and reduce errors? How complex is it to implement from a technical standpoint?
Yeah.
So basically, you're scoring each requirement based on these weighted criteria.
So it's almost like a triage system.
Exactly, you're prioritizing based on what's most important.
I can see how that would be so valuable in making those tough decisions about what to focus on first.
Especially when you have limited resources.
Right. You can't do everything at once.
Yeah.
So this helps you figure out where to start.
Absolutely.
Okay, so we've got our prioritized list of requirements.
Right.
But even with that, sometimes it's hard to see how it'll all fit together in real life.
Yeah, you need to be able to visualize it.
Yeah, exactly. And that's where our third strategy comes in: Agile requirements workshops and user story mapping.
Yes, love this one.
So what makes this approach so unique?
So instead of just trying to map out every single requirement up front,
Right.
you bring together a team of stakeholders.
Okay.
And I'm talking IT, clinicians, administrative staff, everybody.
So a good mix.
Yeah, a real cross-functional team.
Yeah.
And you work together in a really hands-on way to define what the system needs to do.
Okay, so it's much more dynamic
Yes, much more interactive and collaborative.
than just sitting in a room and writing a document.
Exactly. And instead of talking their abstract requirements, you create user stories.
User stories, okay.
Yeah, and those are basically short, simple descriptions of a specific action a user wants to take in the system.
Oh, that's cool. Can you give us an example?
Sure. Let's say you're working on a system for patient admissions.
Mm-hmm.
A user story might be, as a nurse, I want to be able to quickly enter a patient's vital signs so I can focus on providing care. Or as a physician, I want to be able to easily access a patient's medical history from previous visits.
I like that it's very specific. It's focused on what the user actually needs to do.
Yeah, exactly. It really brings it to life.
Okay, so we've got all these user stories, but how do we put them all together? How do we get that big picture view of the system?
That's where user story mapping comes in.
Okay.
And that's a visual technique where you map out all the user stories along a timeline or a workflow.
Interesting.
So for our patient admissions example, you might start with the moment a patient arrives at the hospital,
Right.
and then map out all the steps from registration to triage to assigning a room.
Okay.
And then you layer in all the system functionalities that need to support each step.
So it's almost like you're creating a visual roadmap of the entire patient journey.
Exactly. And it's so helpful because everyone can see the big picture.
Right. It's not just words on a page anymore.
Yeah. And you can easily identify dependencies between different tasks and prioritize which features are the most critical.
It sounds like this could really help with communication and prevent things from falling through the cracks.
Absolutely. And because it's so visual, you can see if something is missing or if there's a potential conflict.
Makes a lot of sense. It sounds like this approach could really help keep everyone aligned and prevent those scope creep issues that can derail projects.
Yeah, for sure. And because it's iterative, you're constantly getting feedback and refining those requirements, making sure the system truly meets everyone's needs.
So we've explored these three distinct strategies:
Hmm.
contextual inquiry, stakeholder interviews with weighted scoring, and agile requirements workshops with user story mapping.
Right.
In your experience, do you recommend using all three or just picking one?
I think the best approach is to tailor it to each project.
Yeah.
So you might use a combination of all three depending on the specific project.
Right.
And the stakeholder needs, so you might start with contextual inquiry to get a sense of the current workflows, then use stakeholder interviews and surveys for broader input and prioritization, and then finally use agile requirements workshops and user story mapping to really refine the design
Right.
and make sure everyone's on the same page.
So flexibility is
Yeah.
key, adapting the approach based on the situation.
Right.
And it's important to remember that gathering and prioritizing requirements, this isn't a one-time thing.
No, it's ongoing for sure.
It's a process that needs to happen throughout the project.
Exactly. As the system evolves and user needs change, you have to revisit those requirements, gather feedback, and make adjustments.
So it's all about staying agile,
Yes.
collaborative,
Mm-hmm.
and focused on those solutions that actually meet the needs of healthcare professionals and their patients.
Absolutely.
So we've covered some really great practical strategies.
We have.
But beyond these techniques, what about those other aspects that can make or break a healthcare IT project?
Oh, yeah, the things you can't really capture in a document.
Right. Exactly.
Things like the culture of the organization, the level of leadership buy-in and just the overall appetite for change within the organization.
It's like you can have the most amazing system design,
You can.
but if the people using it aren't on board, it's going to be tough.
It's going to be a really big challenge. Yeah.
Any advice on how to navigate these less tangible but equally important aspects?
I think the key is communication.
Okay.
Spend time building relationships with the stakeholders, understand their perspectives. What are their hopes for this project?
Yeah.
What are they worried about? Create a sense of shared ownership.
And it's not just about the end users, it's about leadership too.
Oh, absolutely. You need buy-in from the top.
How can we make sure we get that support?
I always say data is your best friend.
Okay.
So quantify the benefits, whether it's improved patient outcomes, increased efficiency, or cost savings. Be prepared to address their concerns about the budget, the timeline,
Right.
potential disruptions to existing workflows.
They're ready for those tough questions.
Yeah, it's about speaking their language, showing them how this project aligns with their goals.
Yeah, sometimes it's about framing the change in a way that connects with the organization's values.
Exactly. If they can see how it ties into something they already care about, they're more likely to support it.
And of course, communication goes both ways.
For sure.
You have to be open to feedback.
Even if it's not what you want to hear.
Right. It's a chance to learn and adapt.
Yeah.
It seems like the more you can foster that collaboration and transparency, the smoother the implementation will go.
Absolutely.
At the end of the day, successful healthcare IT projects, it's about more than just the technology.
It really is.
It's about the people.
It's about understanding their needs and working together
Yeah.
to find solutions that make a difference.
Well said.
Yeah.
So we've covered a lot of ground today exploring practical strategies and those often overlooked human elements of healthcare IT projects.
We did.
If you want to dive deeper into these ideas, we've got a bunch of resources for you in the show notes.
Yeah, we encourage you to share your own experiences too.
Mm.
Your insights are valuable as we navigate this ever-changing world of healthcare IT.
That's right. Well, thanks for joining us on this deep dive into healthcare requirements.
Thanks for having me.
Until next time, keep learning, keep innovating, and keep striving for excellence in healthcare IT.